The following segment is sponsored by Oakview Medical Associates.
We are almost to Halloween, and this year's festivities will be unlike anything we're used to because of a new emphasis on pandemic safety, of course. But some things don't change, like from a health perspective, how much candy's too much. We've got a lot to talk about with Dr. Anita from Oakview Medical Associates here to cover it all. Hi, Dr. Anita.
Hey.
Before we get to candy, what are you telling your patients overall about whether they should trick or treat, or maybe how they can trick or treat, creative ideas?
Look, I love the Halloween season. It really kind of kickstarts the whole holiday season. And I think I'm so excited. The fall weather is here and we need to keep it as normal as possible, keeping in mind some safety measures. So I have a few nice visuals that I'd like to share. The first one you see where we have, everyone trick-or-treating in the neighborhood and just maintaining that safe distance. I think that's really key, making sure parents are with their children. It gets dark pretty early nowadays. The other most important one would be wearing a mask at all times. Many costumes come with a mask, but that doesn't substitute the actual mask, the cloth mask that you must wear. Children under 2 must not wear a mask, and anyone that has trouble breathing must absolutely take precautions. The other one would be to socially distance, even if you're not trick-or-treating, but you're, say, hanging out with other kids in the same yard, just maintain that 6 feet distance. And another one would be to wash your hands before and after the whole process. Lots of kids will be putting their hands into the candy jars and things like that. One of the cool things we could do this year, I thought, is to, instead of just laying the candy out for children to come and pick out of the same bowl, maybe individualize them, keep them a little spaced out on the table so that, they don't, it just prevents cross-contamination. That would be something to think about.
All kinds of good ideas, really, of how to keep having the fun, just do it safely. Let's talk candy then. What's the rule of thumb there? Should you ration it out so the kids don't eat it all at once, or do we throw it away when they're not looking? What do you recommend?
I recommend all of that, but it's a day that they're going to have fun. So I really don't want to make it too difficult for anybody. And I don't want to be known as the bad mom here. My own kids love candy. They don't eat that kind of way every day. So I don't really, have any restrictions, but I just tell them to just make sure they don't eat it all on the same day. Maybe they can ration it out for the week or the whole festive season. Another one would be to really substitute, instead of chocolates and candy, but to bring out fruit and vegetables and make it appealing to the children. If you're trick-or-treating and you've laid it outside, I wouldn't recommend it because fruits are perishable, but within your home, within the family or in the backyard, if you have a few neighbors coming in, you can lay out, one year actually I mixed in all-purpose flour with oatmeal, chia seeds, and I made those finger cookies that looked crazy, but they were very nutritious. I did the same thing with pumpkin pie, cheesecake. So I add a little bit of nutritional food here and there, trying to keep the sugar low, but it's impossible to do that. I think just make sure your kids brush their teeth well. So
that's the next thing I was going to say. The sugar has you cringing about the dental health. So what do parents need to keep in mind?
Just make sure you brush your kids brush their teeth twice a day, just like adults should. Your screenings, you have to have your dental checkups. That's basically it.
And finally, it can be a spooky thought for some, but flu shot season is underway. Is the flu shot more important this year than in years past?
Absolutely. Flu has always been around, and we've still had deaths from influenza, hospitalization. So keep that in mind. Don't just because we're thinking, we're socially distancing, wearing masks. Influenza is also, we need to get a grip on that. So I'd highly recommend the influenza vaccination. Getting in touch with your primary care doctors, pediatricians, and making sure you stay up to date on your health.
Well, we want everybody to make it a safe and happy Halloween, Dr. Anita. Talk to us a little bit about Oakview Medical Associates and what makes your practice special.
Our practice is a family medicine practice, primary care practice with urgent care, and we really believe in taking the whole health of the individual into perspective. We are absolutely accessible. We have same-day appointments. We take in new patients the same day, walk-ins, and we just want to be there for our community. We really, I think next year, 2021, is my year to make sure that our community becomes really health conscious, and that would lead to more productive lives, better education for our kids. So we're very mindful of that. So come check us out.
Fantastic. People can contact you, Dr. Anita. Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville. The number 627-0444. Dr. Anita of Oakview Medical Associates, we look forward to talking to you again really soon.
Thanks, Margaret.